Last month, 73-year-old Margaret was enjoying her usual morning routine, a tablespoon of olive oil mixed with fresh lemon juice, a remedy she'd read about online and tried for just a few days. But within hours, she was rushed to the emergency room with severe stomach pain and dizziness. What her doctors discovered might surprise you and could help you or someone you love avoid the same frightening experience. Many health enthusiasts call this a miracle tonic, but almost no one talks about the serious risks it can pose, especially for seniors taking common medications. This harmless-looking kitchen mixture can cause unexpected reactions faster than you think. Stay with me until the end to find out exactly how these two healthy ingredients might interfere with your treatments and how you can still enjoy their benefits safely without risking your health. This information is educational in nature and not intended to replace professional medical advice. Always consult your healthcare provider before making changes to your diet or health regimen. Recent health surveys suggest that approximately 15% of hospital visits among seniors involve preventable food and medication interactions. Many people don't realize that as we age, our bodies process substances differently. While both olive oil and lemon offer tremendous health benefits individually, their combination can create unexpected challenges for seniors. The acidic nature of lemon juice can significantly alter how certain medications are absorbed in your digestive system. Meanwhile, the fat content in olive oil might enhance the absorption of some fat-soluble medications, potentially increasing their concentration in your bloodstream. The bioavailability of medications, how much of the drug actually reaches your circulation, can shift dramatically when consumed alongside certain foods. Research from the Journal of Pharmacy and Pharmacology suggests that fat-containing foods like olive oil can increase the absorption of some medications by up to 65%, potentially pushing them beyond their therapeutic window into levels that might cause unwanted effects. When lemon juice meets olive oil, the acidity can extract different compounds from the oil. For most younger adults, this interaction poses little concern. However, for seniors with more sensitive digestive systems or those taking multiple medications, this combination may trigger uncomfortable symptoms or interfere with medication effectiveness. The nutritional composition of this mixture is worth understanding. Olive oil contains powerful antioxidants and healthy monounsaturated fats that support heart health. Lemons provide vitamin C, flavonoids, and citric acid with anti-inflammatory properties. These beneficial components don't disappear when combined, but the way they interact with medications and your digestive system changes significantly, especially for seniors who may have altered metabolism and absorption rates. A study published in the American Journal of Medicine found that adults over 70 experience almost twice the rate of adverse drug reactions compared to younger populations, with food-drug interactions being a significant contributor. The combination of decreased liver function, reduced kidney clearance, and changes in stomach acid production creates a perfect storm for unexpected reactions. If you're taking blood-thinning medications like warfarin or even daily aspirin, consuming this mixture regularly might affect your blood's clotting ability. The vitamin K in olive oil and certain compounds in lemons can potentially influence how these medications work in your system. For those managing high blood pressure, certain compounds in lemons may interact with your medication. The potassium in lemons, while generally beneficial, might require careful monitoring if you're taking certain blood pressure medications that affect potassium levels. Potassium-sparing diuretics, ACE inhibitors, and angiotensin receptor blockers, ARBs, commonly prescribed for hypertension and heart conditions, can elevate potassium levels in your bloodstream. When combined with potassium-rich foods like lemons, which contain approximately 175 milligrams of potassium per fruit, this could potentially lead to hyperkalemia in vulnerable individuals, a serious condition that affects heart rhythm. If you're taking cholesterol-lowering medications, it's worth noting that grapefruit and some other citrus fruits can affect how your body processes these medications. While lemons have a milder effect than grapefruit, the concentration in a daily olive oil and lemon mixture might still be significant. But there's something many health articles aren't mentioning. The timing of when you consume this mixture can make a substantial difference in how it affects your medication absorption. The cytochrome P450 enzyme system in your liver, which processes many medications, becomes more vulnerable to interference as we age. This system breaks down substances including medications, and certain compounds in both olive oil and lemon can temporarily inhibit or enhance these enzymes. When this happens, your medications may remain in your system longer than intended or be cleared too quickly, potentially affecting their therapeutic benefits. Research from the Mayo Clinic indicates that by age 70, the average person's liver has lost approximately 30% of its enzyme-producing capacity. This reduction means that foods or supplements that would have minimal impact in your younger years might now significantly alter how your medications are metabolized. As we age, our digestive system undergoes natural changes. After 65, many people experience decreased stomach acid production and slower digestive processes. These changes can make seniors more vulnerable to digestive discomfort from acidic combinations. The combination of olive oil and lemon juice creates a particularly acidic mixture that may trigger or worsen certain digestive conditions. For seniors with acid reflux or GERD, this mixture on an empty stomach could potentially trigger uncomfortable symptoms or flare-ups. A comprehensive review in the Journal of Gastroenterology revealed that highly acidic foods with a pH below 4.0, lemon juice has a pH of about 2.0, can trigger GERD symptoms in susceptible individuals by temporarily weakening the lower esophageal sphincter, allowing stomach contents to flow backward. For seniors already experiencing age-related weakening of this muscle, this effect can be more pronounced. If you've experienced gallbladder issues in the past, the combination might stimulate stronger gallbladder contractions, which could cause discomfort for some individuals. Those with sensitive stomach linings might find that regular consumption of this acidic mixture contributes to digestive discomfort, especially when consumed first thing in the morning. The absorption of fat-soluble vitamins, A, D, E, and K, may be affected by this mixture as well. While olive oil generally helps with the absorption of these nutrients, the acidic environment created by lemon juice might alter this process. For seniors already at risk for vitamin deficiencies, this could be particularly relevant, especially if taking medications that further affect nutrient absorption. A 2019 study in the Journal of Nutrition in Gerontology and Geriatrics found that nearly 35% of adults over 65 show subclinical deficiencies in at least one fat-soluble vitamin, with medication use being a key contributor. Statins, for instance, can reduce CoQ10 and vitamin K2 levels, while acid reducers can impair vitamin B12, calcium, and magnesium absorption. Consider Mary's experience. She started consuming olive oil and lemon each morning after reading about its benefits online. After 3 weeks, she developed persistent heartburn that interfered with her sleep. Her doctor suggested she discontinue the morning tonic, and her symptoms improved within days. If you've been consuming olive oil and lemon regularly, be mindful of these potential signs that this combination might not be agreeing with your system. Increased heartburn or acid reflux, particularly if it's new or worsening. Unexplained digestive discomfort that seems to coincide with your consumption. Unusual bruising, which could indicate interaction with blood-thinning medications. Dizziness or lightheadedness, especially if you're on blood pressure medication. Changes in medication effectiveness or new side effects. A particularly concerning warning sign is unexplained bruising or prolonged bleeding from minor cuts. Research published in Thrombosis and Hemostasis indicates that certain compounds in olive oil may enhance the anticoagulant effects of blood thinners by up to 30% in some individuals, especially when consumed on an empty stomach. This interaction is rarely addressed in general dietary guidance, but can have serious consequences for seniors on anticoagulant therapy. One often overlooked signal is a change in how you feel after taking your regular medications. If you notice your medications seem stronger or weaker than usual, this could indicate an interaction with your olive oil and lemon routine. The pH level of this mixture is another consideration. With a pH around 2 to 3, it's quite acidic. This acidity can affect how certain medications dissolve and are absorbed in your digestive tract. Some medications require a specific pH environment to work properly, and altering this environment could potentially reduce their effectiveness or increase side effects, particularly for extended-release formulations designed to dissolve slowly. Many extended-release medications rely on specific polymer coatings that dissolve at a predetermined rate based on pH levels throughout your digestive tract. The Journal of Pharmaceutical Sciences reports that acidic environments can prematurely break down these coatings, causing an entire day's worth of medication to release at once, a phenomenon known as dose dumping that can lead to significant side effects. Timing can make a significant difference in how this mixture affects you. Rather than consuming olive oil and lemon first thing in the morning on an empty stomach, consider having it with or shortly after a meal to buffer its effects on your digestive system. If you appreciate the health benefits of both ingredients, consider enjoying them separately or as part of balanced meals. Olive oil makes an excellent dressing for salads or cooked vegetables, while a squeeze of lemon adds flavor to water or tea without the concentrated acid exposure. For most seniors, a teaspoon of olive oil with a few drops of lemon juice, consumed with food, presents minimal risk. However, if you're taking multiple medications or have digestive sensitivities, even this amount deserves caution. The polyphenol compounds in extra virgin olive oil offer significant anti-inflammatory benefits, but these same compounds can inhibit certain digestive enzymes. Research from the European Journal of Nutrition suggests that consuming olive oil with other foods, rather than on an empty stomach, not only improves its own absorption, but also reduces potential interactions with digestive processes and medications. Before incorporating any daily health tonic into your routine, have a conversation with your healthcare provider. Bring a list of all your medications, supplements, and health conditions to ensure any new addition to your diet is appropriate for your specific health needs. The medication review process is crucial as we age. Even if you've been taking the same medications for years, their effects and interactions might change as your body changes. Most pharmacists offer free medication reviews that can identify potential food-drug interactions specific to your regimen. This service is vastly underutilized despite being covered by many insurance plans and Medicare Part D programs. The brown bag review, where you bring all your medications, supplements, and over-the-counter products to your pharmacist or doctor, can reveal potential interactions you might not be aware of. A study in the Journal of the American Geriatrics Society found that such reviews identified at least one significant interaction in nearly 58% of seniors taking multiple medications, yet only about 20% of eligible seniors regularly participate in these reviews. Remember these important considerations. First, healthy ingredients can interact with medications in unexpected ways. Second, the timing of when you consume olive oil and lemon matters significantly. Finally, individual health conditions and medications create unique circumstances that require personalized advice. Your health journey in your senior years deserves thoughtful consideration rather than following general internet trends. What works perfectly for a healthy 40-year-old might require adjustments for those over 65 with different health considerations. Please share this information with friends and family members who might benefit from this awareness. For more health information specifically designed for seniors, subscribe to our channel. We're committed to bringing you evidence-based health guidance that honors the unique needs of our senior community.